When is plantar fasciitis not actually plantar fasciitis? I had a client come in yesterday with a diagnosis of plantar fasciitis and a request for physical therapy from a podiatrist to help with his plantar fasciitis. But the patient started telling his story, and I was like, this is not plantar fasciitis. So let me show you why it wasn't, using my son as the example. All right, this is Austin, and he's gonna help me demonstrate this. So you'll notice that his feet are elevated on something. And one of the client's complaints was that the pain started with an electric sensation while he was sleeping. Plantar fasciitis doesn't start with electrical pain, and it doesn't happen while sleeping. It usually happens with your first couple of steps in the morning or first couple of steps of driving. So what I did with the client was I took the leg that he was complaining about and raised it like this, and he was really tight. We stopped here. So already I know his nervous system is super tight. And I said, does that recreate your pain? And he's like, I can kind of sense it. And then the non-painful plantar fasciitis side, I lifted this side and we got to about here. And he said, oh, I definitely feel that in my left foot. Yes, that's my pain. And I was like, great, you don't have plantar fasciitis. Let's find out where it's coming from. So then I came up to his head and I pulled on his neck just like this and held steady. And he's like, yep, that's definitely also increasing the pain. And I said, okay, great. I let it go, let him rest for a couple of minutes, got him back down to 0 and pressed. And he said, that creates some weird irritation in my calf. And I was like, okay, noted. And then I took his head and I tucked it towards the chest. And he said, yep, that for sure also increases my pain. Thanks, buddy. The reason he was sent to me is because these symptoms were 5 weeks old and he had been doing what the podiatrist told him to do. But the podiatrist still said, yes, it's plantar fasciitis. We're just going to have you see a physical therapist and have them do some aggressive manual therapy. If I hadn't taken the time with this patient, if I took his insurance and we're seeing 6 patients an hour or even 4 patients an hour and was doing that to be able to be profitable as a physical therapy clinic, I would not have actually heard his story about origin pain, and I wouldn't have heard what activities were creating pain and what he was doing to relieve the pain. I also probably wouldn't have taken into account other injuries that he's had, and he has had a back injury. He had a concussion 8 months ago, and he had a neck injury due to that concussion. That concussion also resulted in some vertigo that has since resolved. We worked on that and it went away. I also would not have heard this client say, because I wouldn't have asked the question, he has gout. Knowing that he has gout indicates that his entire system is inflamed. And so then when I asked him to send me his blood work and I could see it, there was a lot of inflammation there. All of that inflammation is basically for him resulting in neuropathy, but also tension throughout his entire nervous system. So our goal is to downregulate his nervous system so that the pain in his feet goes away, because it's not plantar fasciitis. He's also got this little virus hanging out in his system that we're going to help him clear up. But it's important to realize that when you have the same thing happening over and over and over again and it's not healing, that maybe number 1, it's not the right diagnosis. But number 2, it might not be the right treatment plan because it's not getting to the root cause of the issue. And I applaud the doctor for doing the blood work. But also, she told him, you're fine. Just keep doing what you're doing. Maybe drink some more water. If you've been struggling with chronic pain, or you have had that feeling like no one is really understanding what is going on with me and you want more help, I offer consultations. You can click the link below to get in touch with me.